Hello and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. I am Mary Joseph and I am your host for today. Please do well to follow us on all our social media platforms that you can find on our website at spectrumtv.ng to be a part of the family. On today's episode of Wellbeing, we will be talking about drug abuse and harm reduction. The issue of drug abuse is fast becoming a public health concern in Nigeria, as the country has now been ranked amongst the countries with the highest drug prevalence not only in West Africa, but globally. According to the United Nations Office on Drug Control, that is the UNODC, drug use prevalence in Nigeria stands at almost 15%, almost 3 times higher than the global average. But when more than half of the Nigerian population are youth and are also one of the most drug users, there is an urgent need to close the gap on the disturbing trend. Well, to further sensitize youth on the dangers of drug abuse and harm reduction, we will be having our guests in the studio who will be talking much more about the issue. But then, let us quickly go on this short timeout. We'll be right back. You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you could visit our website at spectrumtv.ng to be a part of the family. Well, on today's episode of Wellbeing, our focus would be tailored to drug abuse and the concept of harm reduction. So it's time for us to link up with our guest. He is Mr. Aniedi Akpan, the Chairperson, Drug Harm Reduction Advocacy Network, where he sheds more light on this issue.
Okay, my name is Aniedi Akpan. I'm the Chairperson of Drug Harm Reduction Advocacy Network. It's a network of drug user community-led organizations working with people who use drugs. I also run an organization as an executive director, Drug Free and Preventive Healthcare Organization. Drugs abuse, abnormal use of drugs. So it's the use of a particular drug for the purpose for which it was not made for. For example, you have paracetamol, it's supposed to be for pain, but if you use paracetamol to get a high, then it is abnormal use of paracetamol, so it's abuse. When we talk about substance, it's a wider, it's not just about drugs, it's other, what we call, there are some things that are classified as new psychoactive substances, some things that are non-traditional drugs, like people talking about using lizard dung to get high. So substance embodies a whole lot more than drugs. Drug abuse and substance abuse can be linked to so many things that are problems in the society. It can be linked to mental health. It has an inverse relationship because mental health can reinforce drug abuse and drug abuse can reinforce mental health. It can be linked to crime because when you have criminal gangs running streets, illicit drugs in the street, there's definitely going to be weaponization of their operations. There are going to be so many other things. There are going to be rival killings and so many things. So it can be linked to insecurity, can be linked also to reduction in productivity of the society, because somebody who uses drugs and does not have that motivation to work again because of the drug use is definitely going to be less productive than that. So it covers a whole lot, reduces the GDP of the society, it reduces productivity, and causes problems in terms of security and crime. Well, scientifically, we say there are many things. There's predisposition to drug use through genetic factors. There's also the environment where the person grows up. If you grow up in an area where there's a, it's a drug-infested area, there's sure a likelihood that you're going to use drugs. And there's also peer pressure that, especially for adolescents that are coming up and then getting to experiment new things in life. That causes it. There's also the need for sexual exploits by young people, especially for young people who are addicted to tramadol. So there are a whole lot of factors to it that can cause people to abuse drugs. It boils down to the perception of friends, family, society to drug use or drug abuse, how people want to look at it. But I would prefer to use drug use. So how does it affect that? If the family is against drug use, or maybe there's a moral or religious or, societal, value they hold on to that they feel someone should not use drugs, then definitely you're going to have a situation where the person who is using drug is going to stigmatize, discriminate it, the social circle will keep reducing because, of course, if I don't like what you're doing, definitely I'm not going to be close to you. So you start seeing a shrinking of the social circle from family, friends, getting to school, work, because most people have a perception of people who use drugs as people who are not stable and people who cannot do well in whatever they are doing, which sometimes it's wrong, sometimes too is true, depending on the mental state of the person. The red flag is that you will start noticing abnormal behaviors. For example, if I'm going to talk from my experience. I used to be very close to my mom, but when I started using drugs, I started withdrawing myself. Why? Because when I finish using the drugs, I'm afraid she's going to know that I have used drugs. So when I'm coming back, I'm not going to go to her. I'm going to look for a way to get to the bathroom, brush my teeth, change up, freshen up, maybe spray myself so that when I get close to her, and for most of the drugs, it's going to show in the eye. There's going to be dilated pupils. There's going to be redness of the eye. So all of those symptoms, when you look at your child as a family or your relative as a family member, those are the things you need to pay attention to. Is this person that was close to you withdrawing? And why is the person withdrawing? Are they physical signs? Because, of course, when you use drugs, there are definitely going to be physical signs that they are using drugs. And that's it. But also, I just want to put this, and I think that is why most young people are moving away from the traditional cannabis, which causes the redness and dilation of the pupils, to things like tramadol, because there's not going to be any smell with tramadol. You're hardly going to notice that the person has taken anything. You might just notice the dullness, which can just be explained away. But all the same. So the potential complications are physical, there's mental, and there's social. Definitely, like we explained, if we start from the social, you're going to move away from your friends who are not people who use drugs and move to those who use drugs. And of course, as you're moving to those who use drugs, you're going to inherit their baggage, kind of. So if there are people who are involved in criminality, definitely by association, you are also involved in criminality. That's for the social angle. And then as the social circle keeps shrinking, so opportunities shrink. If the family is withdrawing, so it means if you were being supported for education, it means that support will not be there. Most times housing becomes a problem because most families will not tolerate you staying in their roof to use drugs. So you're going to be thrown out on the street, and then a whole lot of complications. If you were working and your employers find out and they are not disposed to working with people who use drugs, you're going to lose your job. And so a whole lot of things physically. For some drugs like methamphetamine, people start losing their teeth. They start losing their teeth. It starts eating up their teeth. For people who take soak and die, they start having issues, lesions. People who take heroin, especially when they are having withdrawal symptoms. Withdrawal comes in different ways. Some people come through dysentery, some through diarrhea, some through, fevers, some through rashes and all of that. So you're going to see these physical signs. And then some drugs too, because of the impurities in the drugs, will also have effects on the skin, on the liver, on the kidney, on the spinal cord, on the brain. The vital organs of the body is going to be affected. And then mentally, of course, some drugs cause irreversible damages like methamphetamine, which is what we call mkpuru in Nigeria, or ice, causes irreversible brain damage. So the whole gamut of the physical, mental, and social life of the person is affected. Yes, there's a way out, but it has to be consensual. Yeah, it has to be with their consent. The decision has to come from the person. And, there's a whole array of drug use. In the spectrum of drug use, there's a whole array. There are people who are experimental drug users. There are people who are recreational drug users. There are people who are dependent drug users. And I would like to talk about, put this in the case of dependent drug users. Yes, there's hope. For those who are dependent on drug, it means that everything that they do, the life they live, their activities is geared towards getting the next dose of drugs. And that is where there is a problem. Most times the dependent control drug, control drug users, the recreational drug users, and the experimental drug users may not really have a problem. But the dependent ones, there's hope. We have various treatment programs in the country. We have treatment centers, some that use psychotherapy, which is just motivational interview and trying to get the person to understand why they should reduce or stop their drug use. And then there's what we have now, which is the medical assisted therapy, which we are trying to start up, especially for people who use heroin. And also, one thing I want us to know is that about 90% of those who use drugs, who have used drugs, experimented with drugs, do not get dependent on drugs. Only 10% of the people, it's scientific, 10% of people will get hooked on drugs or dependent on drugs. And so for those people, it's possible that they could be using drugs and then along the line they stop drugs. And there are different factors that can stop that. And we know that over time, if we look at the whole data about people who use drugs, you'll notice that people from the ages of 56 up rarely use drugs. Over time, people get to wean themselves out of their drug use without any formal intervention. If you look at the Nigerian drug use survey, national drug use survey, you'll find out that fewer people use drugs from that age. Yes, we still have a population of that, but mainly it's between the age of 18 and 56, even though in some cases you have initiation of drug use as low as 10 years of age. But as people grow older, their priorities changes. And if they are still using drugs and still physically, mentally, and socially fit, then you find out that people gradually wean themselves off drugs. But apart from that, there's drug treatment centers that can provide some services, psychotherapy services, psychological services, and counseling services to help people. The first line of action to take is to talk to the person who is using the drugs, understand the kind of drugs they are using. That's the first line, because most times people worsen situations of people who use drugs by the actions the family takes. Let's say, for example, a child who has just experimented with cannabis, and then the parents get to know about it. If that child is not handled carefully, some parents might be too harsh and push the child out of the house to the streets, which will worsen the drug use issue. First is to understand what drug are they using? What is the frequency of their use? Ask them, do they need help with their drug use? It is not for us to make the assumption that, we should just step in and help. Because most times for drug use, it is the individual that makes the decision. Just like people who are into mountain climbing or skydiving, it's dangerous, it's risky. You could lose your life. But it's the individual that makes the decision, because, of course, we have a right to bodily autonomy, we have right to independence of thought and action and all of that. So it's from the basic talking with the person that you understand whether the person needs help. And then if the person needs help, then you can start seeking for help for the person. But if the person does not need help and the person is willing to stay off drugs or stop using the drugs, then you really don't have any problem. It's just to monitor the person and the progress. Yes, right now in Nigeria, we have about 9 model drug treatment centers that are spread across the country. Why we are calling the model treatment centers is because they incorporate all the WHO principles and UNODC principles for drug treatment, including consent, for treatment and all the standards that are needed in a drug treatment program. We also have other ones which are not model private treatment centers. They are quite expensive. We understand that teaching hospitals are supposed to go into drug treatment, but the problem is that most of the doctors have not been trained on handling issues of drug use. And so we can only say that for now, what we have as standard is 9 drug treatment centers. For now, it's the NDLEA, but that is where the problem is. Because if we look at the NDLEA Act, the NDLEA Act empowers the NDLEA to control supply and also control demand. So the NDLEA is looking at pursuing people who are producing and distributing drugs, and at the same time also taking on the responsibility of treating people who are not selling or cultivating, but who are using. And that is where the conflict comes in. Because drug use is not a law enforcement issue. It is a health issue. And that is one of the things we've been advocating, that drug use should be moved from the gamut of the NDLEA to the Ministry of Health, because it is a health issue and not a law enforcement issue. The typical example is that for the maybe I'm just I'm with my friends, and then my friends say they use drugs, and then I'm around them, and so maybe I say, okay, let me experiment, and I take one drag of the drugs, and then I'm arrested. I'm taken to a cell and kept there. It is from there. Most times when people are arrested for issues of drug use, when they come out, they go deeper into the drug use because of the whole trauma that goes with arrest, the embarrassment, parents getting to know that, I was arrested because of drug use. So, and the whole social discrimination and all, it pushes those people back to the arms of those who are the drug users. And that increases their drug use. The NDLEA is present in every state of the country, making things worse, I must say. Yeah, on record. Making things worse. Because what we have as NDLEA treatment centers are actually torture centers. And it's actually going to increase the trauma. You can check around in any of the states where they say they have drug treatment centers. So the whole idea is the person is arrested and the person is said to be going through counseling. But while the person is going through counseling, the person is actually in a cell. Even though they say the person is isolated from others, but restriction of freedom of movement is an arrest. The person is in a cell. And apart from that, the question we would want to ask is, do they have trained counselors who understand issues of drugs and how to go about talking with people who use drugs, motivating them to reduce their drug use? And also, you also look at the setting. This is a closed setting where somebody is kept in one place and talked to. You have not seen the interaction of the person in the open society. The person is not allowed to go home to report back. And because this person is kept in this particular place, it is forced. And so you cannot assure anybody that when this person comes out, this person is going to stop drug. It's a punishment strategy and not a treatment strategy. So it's making things worse. I can say that, and I've been saying that. They need to stay away from the triggers of drug use. One of the triggers of drugs use for most people who use drugs is being around where drug is used. So if somebody is smoking cannabis and somebody is recovering, that person doesn't need to be around where cannabis is being smoked, because once that person sees it, then it ticks something in the brain, and then, the whole process of craving comes back to the person. They need to avoid that. They need to engage in activities that promotes their health and healthy lifestyles, not in activities that will bring trauma, which might trigger them to go back to their drug use. And then sometimes if there has been a proper psychological counseling done, and we've known the point of inflection, the point at which something happened which made the person use drugs, is to avoid that thing altogether, so that you don't trigger that need to use drugs again. Okay, so for us, we are mainly concerned with harm reduction. We are Drug Harm Reduction Advocacy Network, and we understand that there are people who are not using drugs, so prevention services for them. But how about those who are using drugs? How do we keep them safe? How do we reduce the harms of their drug use long enough for them to be able to, make that decision to either stop or reduce their drug use? And so with the support of peers and other organizations, we're able to advocate for the needle and syringe program, which was mainly for people who inject drugs. The pilot was conducted in Akpa Ibom, Abia, and Gombe states. And it brought out interesting results. We're able to share needles to people who inject drugs, reduce the rates of bloodborne transmission of bloodborne infections, reduce the rates of abscesses and tissue damages, vein damages. We're also able to make contacts with them and also provide other services, which health services and social services, which they would normally not receive because of, criminalization, stigmatization, and discrimination by the society. Apart from that, we are also involved in, the development of the medical assisted treatment guideline, and we will be involved in the implementation of the medical assisted treatment, which is for people who use opioids to replace the use of illicit opioids with medication that can help them stop the use of illicit opioids. We also got support from VIV Healthcare to implement a women-only sexual reproductive health and rights service for women who use drugs. Now, the good thing about it is that apart from just implementing these things for the women, we've been able to use the project to strengthen our health system. For example, in Gombe State, which is one of the states apart from Abia, FCT, that is being implemented, we've been able to kind of have quarterly coordination meetings between the different government agencies, including the Ministry of Health, the Gombe State Agency for the Control of AIDS, including law enforcement, police, and NDLEA, and other civil society organizations, and Ministry of Women Affairs. What that has done is that some of the people who use drugs, who have been discriminated against and have not had any form of income-generating activity, we've been able to attract support from the Ministry of Women Affairs to give them something, train them on income-generating activities. And it's been amazing. It's been amazing that apart from just looking at harm reduction, we've been able to go into other services like cervical cancer screening, minor surgeries for cervical cancer, child care services, and so many other services. So it's helped strengthen services for women, not just women who use drugs, but also for women in general. And I think it's a model that, women who are not using drugs should keep into. Right now, there's really no, should I say, defined system of support. It's all donor dependent. It's donor dependent. In our program, what we've done, the income generating activities, part of what we've done as a support system to say, for those who have no way of supporting themselves, who've been thrown out for so long, who are not educated, to be able to give them something that they can go back to, that can keep them busy, so that they will stop use of drugs. But also, what we also do is that we provide family therapy. So we try to get to know the family members of the person who uses drugs. Of course, most times they've been abandoned over the years, and then try to bring about a reconciliation between the person and their family, so that they can take them back and reintegrate them into the society. But apart from those particular donor-funded and organizational initiatives, there's really no fixed support system for reintegration. I think it's ignorance on the part of many people, because I mean it's the same as stigmatizing someone for having HIV, or stigmatizing somebody for being diabetic, or stigmatizing somebody for having a liver problem or a lung problem, or stigmatizing someone for drinking alcohol. Because a lot of people use alcohol, but they don't get stigmatized. I think the whole stigma thing is cultural. It's cultural and maybe moral. And, like we say, morality is not a universal thing. It's individual. So I think it's something we shouldn't accept as a society. We should first of all see people as human beings, apart from their habits, apart from the different issues, health and mental issues that are around them. I know there's a lot of stigma. We stigmatize people who have mental health issues. We stigmatize people because they use drugs. We stigmatize people because they sell sex. We stigmatize people because they have a different sexual preference than we do. But all of that is wrong. And it creates more of a problem in the society than it solves. Yes. I like to say that drug use is a reality in this world. Maybe when we are there, it won't be. But it's a reality in this world. I would also like to say that there are different, spectrums of drug use. There are people who use drugs occasionally, like, for example, some people drink alcohol only when they sit out with friends. Apart from that, they don't drink alcohol. That's the way drug use is. I would also like to say that we need to understand that it is not everybody that uses drugs that has a drug use problem. Some people use drugs, they do not have a drug use problem. How do we classify drug use problem? Is the person is having issues mentally, physically, socially, not able to keep a job, not able to, meet up with financial obligations, separated from family, separated from friends, homeless, and all of that. Not everybody who uses drugs. And that's where we have the distinction, because we know that a lot of people who are in the upper echelon or in the upper social class who use drugs, they do not have drug use problems. And so we need to look beyond the drug use itself and start looking at what are the other factors that can be improved in the life of a person who is using drugs to be able to make the person functional and productive in the society. If we look at that, then we will be looking away from stigma. We'll be looking away from discrimination. So we understand this person is using drugs, but he's not educated. Will he go to school? Does he want to go to school? Most times when somebody who uses drugs has something that is of more interest than the drug use, it tends to reduce the search for drug to use. And so that's what we need to see. The stigma, the discrimination is not necessary. What is really necessary is the life of the person and how you can improve the life of that person.
So that was Mr. Aniedi Akpan, who is the chairperson, Drug Harm Reduction Advocacy Network, where he talked about the adverse effects of drug and substance abuse and how important it is for us to keep pushing conversations on the dangers associated with it. Thank you so much for being a part of today's episode. Remember that you can always be a part of the family by following us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Until we meet again, remember that testing is important, so get tested, know your status to gain control of your life.